Assalamu alaikum, sir.
Welcome, Sam.
Say, I've went to Zimbabwe. I've seen a patient with swollen limbs. What is this?
So you were on a vacation in Zimbabwe and you saw a patient.
Yeah.
Okay, yes, this patient is of Elephantiasis or Filiriasis.
Oh. So why is it called elephantiasis?
Because in this patient, the limbs and usually the face and other parts of the body as well, genitalia and the breast, they become swollen. The skin becomes swollen and thickened and roughened, and it gives a false appearance like that of an elephant. That's why it's known as Elephantiasis.
So what type of a disease is this one?
It's a parasitic disease actually caused by a parasite which is known as Vaccaria bancrofti.
Oh. So does it have any vector?
Yes, this parasitic disease has a vector, and that vector is known as the mosquito, the famous mosquito, which kills most of the people every year. And the species of mosquito which is involved in this disease is Culex, Anopheles, the Aedes species, as well as the Mansonia. And yet again, this is common in those parts of the world which are the tropical and the subtropical region. You know, your Zimbabwe, Africa, South America, those Caribbean islands, and even in our part of the world, Asia, South Asia, and India, and all of these areas are very frequently affected.
So what is the pathology of this disease, sir?
After the mosquito bite, the parasite travels from the subcutaneous tissue into the lymphatic vessels. It is carried to the lymph nodes where its filariasis form proliferates and it blocks the lymph nodes, and the lymph flow is obstructed in that part of the body, which gives that swollen appearance to that part of the body.
So is there any drug which you can give to the patient?
Yeah. Diethyl carbamazine is the drug of choice in this case. It's been given for more than many decades since now, and yet there is supportive care as well. For example, you have to elevate that limb or that part of the body, particular exercises which increase the lymph flow, and then you have to use compression dressings or stockings if it's in the lower limb, and definitely you have to take care of the hygiene.
So say, is there any surgical interventions which you can do on this patient?
Yeah, there are two major surgical interventions. One is debulking surgery. In debulking surgery, you remove the extra subcutaneous tissue, and that is basically the Charles procedure. While there is another type of surgery which is known as lymphatico-venous anastomosis, in which we create a shunting type of channel from which the lymphatic flow is maintained towards the veins, and this procedure is known as modified Bassett procedure.
Wow. So can it be prevented?
Obviously, yes, it can be prevented by all of those routine methods by which you can just prevent a mosquito bite, like the use of nets, repellents, draining of those areas which are having a lot of standing static water, and those mosquito mats and all of those stuff.
Oh, thank you, sir.
You're welcome.